Welcome, everyone. It's a pleasure to have you all here. Every year since 1954, we have marked Veterans Day through ceremonies, pageants, parades, and other events designed to honor the men and women who have served this nation so selflessly in the armed forces. And we will do so again across the nation tomorrow. Our servicemen and women are the very best demonstration of our nation's greatness. Folks who have stepped up, have taken the oath, have put on the uniform so that the rest of us can live in a country that is safer and more secure. For their service and sacrifice, warm words of thanks from a grateful nation are more than warranted. But warm words are not nearly enough. Today, together, we are calling on Congress to do more than honor our veterans. We are calling on Congress to act. Today, we are calling on Congress to stand up for our veterans and to have their backs just as they have had ours. For the veterans who have carried out their duty as a grateful nation, we must do more. And because of what they have done for us, their health and well-being must always be a priority. Every day, hundreds of thousands of dedicated public servants at the VA help us honor that commitment. At VA hospitals across the country, many doctors and nurses work hard to deliver world-class care. But we all recognize that there are improvements that can be made. We have to go further to improve the VA hospitals, to reduce the long wait times, and to ensure that all veterans, every single one, gets the care they need and the care they deserve. Today, together, we are introducing legislation, Senator Rounds and Senator Warren and Senator Tillis and myself, called the Veterans Healthcare Staffing Improvement Act to help meet that goal. This legislation makes common sense changes in staffing policies to improve veterans' care and working conditions at VA health facilities across the country. First, it would establish the Docs to Doctors program, increasing the ability of the VA to recruit veterans who have served as healthcare providers in the military and are leaving the military. And this is just common sense because we hear again and again from returning veterans that they want to have a new mission and they want to continue helping their fellow Americans and their communities. What better way than allowing a veteran with a medical background to have a facilitated path to serve their fellow veterans in the VA system? It is a win-win to cut red tape so that these doctors and other health care providers can transition seamlessly from the military system to the VA system. This legislation also creates uniform credentialing rules, which surprisingly are not uniform across our nation. And it eliminates the re-credentialing when veterans or when medical personnel move from one hospital to another, which has been an endless source of frustration and delays, or when they want to split their time between two VA hospitals. And it provides full practice authority to advanced practice registered nurses and physician assistants in the VA health system, which will help to make more primary care providers available in rural areas. Writing these measures into law will make the VA more effective and more efficient, make it easier for the VA to achieve the staffing levels that they need to do right by our veterans. Caring for our veterans in an area where Democrats and Republicans should always be working together, where the House and the Senate should always be working together, and it's good, therefore, to be launching this with this bipartisan coalition. I want to note that my Oregon colleague, Congressman DeFazio, has been working side by side with my team confronting some of the challenges we've seen at VA medical systems in Oregon, in medical centers in Oregon, and he will be introducing companion legislation in the House next week. And I do hope that we will have colleagues in both chambers from both parties rally together to make sure that every veteran has full access to the care and benefits that they have earned. And now I'm delighted to turn this over to Senator Mike Rounds.